Okay, Dr. Ashraf, Mrs. Amal is 35 years old. Okay. Dr. Ashraf, the cam is opened. You can mute the cam.
Yes.
Okay. Mrs. Mona is Mrs. Amal. Okay, Mrs. Amal is 35 years old. Okay. And she is now in case of hepatitis C. She is receiving treatment in the form of interferon alpha for her hepatitis C, which seems to be stabilized. She has also skin rash since she started the treatment 2 months back. Please take focus history and focal examination and proceed as appropriate. Again, Mrs. Amal is 35 years old. She is now in case of hepatitis C, and she is now on treatment of hepatitis in the form of interferon alpha and ribavirin. And since she started treatment, she has skin rash for the last 2 months. Please take focus history and proceed as appropriate.
ماشي يا باشا. ثواني بقى.
دكتور الحسيني معنا؟ دكتور الحسين؟ دكتور أشرف, you are going to the exam next diet, huh? دكتور أشرف شحاتة.
ان شاء الله يا دكتور صادق.
بالتوفيق ان شاء الله يا دكتور أشرف, بس عشان خاطري التايم, ارجوك التايم. يعني والله you can pass very easily, بس التايم خلي بالك منه.
بس هنا الاوفو بيتاخر شويه عقبال ما اقول الكلام وانت تسمع وترد. المساله في الحقيقه ما بتبقاش كده يعني. في الواقع بيبقى اسرع من كده.
انا بيتهيألي والله هو يعني بالعكس, ده هو زي التليفون, يعني الصوت بيوصل بسرعه قوي وفيري كلير يعني.
لا بس انت كنت بتفكر في, يعني كنت اسالك سؤال تفكر في الرد, تاخد وقت شويه عقبال ما ترد وبعدين اسالك سؤال تاني. يعني الحقيقه يعني مثلا سالتك في البدايه خالص, قلت لك السبوتس دي هل هي ريزد على السكين ولا لا. قعدت تفكر شويه وقلت لي ما ردتش عليا, قلت لي ده هي وايت وكفرد ومش عارف ايه. فيعني برضو البيشنت اللي قدامك بيبقى حاجه تانية, يعني بيبقى الكلام اسرع شويه وحتى ردوده بتبقى اسرع يعني.
انا معاك طبعا, بس يعني هيبقى الفرق تقريبا دقيقه ولا حاجه يعني ما بيننا وبين اما تبقى directly to the patient. لكن برضو في عارف في explanation of the or replying of the concern برضو you are taking long time, لان البيشنت ممكن يبقى عنده اكتر من concern. فبالتالي we have to be focused بس in reply and very simply.
ان شاء الله باذن الله ان شاء الله.
بالتوفيق يا دكتور اشرف ان شاء الله. دكتوره رشا انت accepted؟ امين يا رب. accepted.
أيوة.
طب ما شاء الله. very lucky.
يا رب في الامتحان برضه بقى.
ان شاء الله يعني هتبقى يعني اخر مره يا دكتور رشا.
يا رب.
Okay, Dr. Ashraf Hatsa, shall we start? Dr. Ashraf?
ايوه يا باشا، اتفضل يا باشا اتفضل.
Okay.
Good morning, Miss Amal.
Good morning, doctor.
I'm Dr. Ashraf Atwa. I'm the senior house officer in the medicine clinic. Are you? I just confirmed you're 35 years old, Miss Amal.
Yes, doctor.
Nice to meet you. Mrs. Amal, I received a letter from your GP telling me that you have a rash in your skin 2 months back. That's right?
Yes, doctor.
Please, would you tell me more about this rash?
This skin rash started with me 2 months back, doctor.
Excuse me, Dr. Saleh, when the patient told me that there is a rash, I have to say, may I see it so I can see the distribution of the rash?
It's
and
okay,
the
this you're
shape
right.
of the rash, the size. Yeah.
Yeah.
Would you show me it, the rash, please?
Yes, doctor. The rash on the elbows and on the hands,
Yeah.
there's some aspects,
Yes.
and also in the back and on the knees also.
Yes. Yeah.
It is raised rash, erythematous,
Yeah. Yeah.
and raised on the skin.
I'm sorry for that, Mrs. Amal. This rash increases in size or stays the same since it starts?
No, it is increasing, doctor.
I'm sorry for that. Is it itchy, Mrs. Amal?
No, doctor.
Not itchy. Mrs. Amal, its color is, would you describe me its color exactly? Silvery,
It's ridge, doctor.
reddish, scaly. There is a scales on the rash.
Yes, yes, doctor.
I'm sorry for that. Tell me what increases rash or relieving the rash?
I'm not sure about that, doctor. It increased since I started
about
my
the
treatment for
surround-
my hepatitis, doctor.
I'm sorry for that, Mrs. Amal. What about the surrounding skin? Is it normal or affected?
I'm not, no infection, doctor.
No, I'm sorry for that. Mrs. Amal, you have hepatitis C diagnosed since 2 months, that's right?
Yes, doctor.
And you are on medication now, interferon alpha and ribavirin, that's right?
Yes, doctor.
I'm sorry for that. Tell me, Mrs. Amal, is there any rash in your scalp?
No, doctor.
especially in the hairlines?
No.
You told me there is a rash in your back. Is there any rash in the clefts or in your back passage?
What's the problem with my back passage, doctor?
Not in the cleft or your pattern.
Doctor, the rash in my back, not, it isn't down on my back.
Mrs. Amal, is there any family history of a similar rash like that?
No, doctor, never.
No. Mrs. Amal, you smoke?
Yes, doctor.
How many cigarettes a day?
10 cigarettes per day, doctor, for the last 5 years.
I think, Mrs. Amal, it's better to think about stopping smoking because smoking actually increase this type of rash. Would you mind to do this?
No, I don't know about that, doctor.
No, I think it's better to stop smoking. You have to think about this issue. If you want, we can
Okay, doctor.
send you to the smoking station. Do you drink alcohol?
Okay, doctor. Yes, doctor.
You drink alcohol? How many units per day?
Yes, doctor.
How many units per day, Mr. Amal?
It is maybe 2 glasses per week, doctor. It's only social.
And the weekend is the same?
Yes, doctor.
Okay, Mr. Amal. Do you have any other present addiction?
If anyone opening the cam, just to mute the cam, please. Again, doctor? Again, Dr. Ashraf?
Mrs. Amal, do you have any drugs other than this medication you are regular in?
Yes, doctor. I have hypertension for which I'm taking lisinopril, doctor.
I'm sorry for that. Do you have any elevation or high blood sugar?
No, doctor.
Do you have any disease runs in your family?
My mother, doctor, has hypertension. My mother has hypertension, and my father has diabetes, doctor.
I'm sorry for that, Mrs. Amal. Mrs. Amal, what do you do for a living?
I'm a secretary, doctor.
Would you think that your condition affects your work or your job?
Yes, doctor, so much. I feel embarrassed when I go to work because of this skin rash.
I'm sorry for that, Mrs. Amal. I'm sorry for that, Mrs. Amal. You hear me?
Yes, doctor.
Yeah, I would contact your occupational physician. I will tell them about this problem I have. I think he have to solve this problem for you.
Okay, thank you, doctor.
With whom do you living, Mrs. Amal?
I'm living with my husband and I have one kid, doctor.
And your husband is okay? He's helping you?
Yes, doctor.
Okay, that's great. Mrs. Amal, may I know what's your concern?
Yes, doctor, I'm concerned about this skin rash. What it could be, doctor?
Mrs. Amal, I think it is a disease called psoriasis. Did you know about this disease before?
No, doctor.
It's a type of disease which is called the autoimmune disease, in which the immune system of the body, which protect us against germs, attack our own bodies, especially the skin, and leads to proliferation of the our skin.
Yes, doctor.
And leads to this condition. You follow me?
Is it related to my treatment that I am receiving, doctor? You know, I have hepatitis C and I'm receiving treatment interferon alpha and the ribavirin. So it may be related to the treatment that I'm receiving, and the skin rash started when I started this treatment.
Yeah, actually, it may be related to your medication. Also, it may be related to your antihypertensive medication, and also it is increased with smoking and alcohol. And so, I would like you to think about smoking cessation, and it will help you in this matter.
Yes, doctor. So, doctor, if it is related to my treatment for hepatitis C, you are going to stop this treatment for me?
Actually, we will not stop their treatment, but we will refer you to the multidisciplinary team, including the GI doctor or the gut doctor and the skin doctor, to prescribe you the proper medication to control your rash. But I think we have to continue your medication for hepatitis. And also, we have to change this antihypertensive medication, Lizino. We would like to change it for another medication because it may exacerbate also the rash, as I remember.
Yes, doctor. Examination?
May I have another examination? I have to look for the rash, the size, the size, the distribution, the scales, the surrounding skin, and also general examination. I have to check the abdomen for any organomegaly, any anemia.
Why the abdomen for organomegaly?
Because she has hepatitis.
Why you want to examine that? Yeah.
She has
okay, but your examination be for the skin rash.
Yeah.
Okay.
If you don't want me to examine the abdomen, it's okay.
It's okay, yeah, okay. Go on. What else? You are going to examine?
The nails. I have to examine the nails for needle changes.
Okay.
I have also checked the joints.
What needle changes you are going to find in this patient? What needle changes you want to check for this patient?
Yeah. I think the more common is nail pitting, transverse ridging, periangular fibrosis or fibroma, I think.
Subangular hyperkeratosis.
Yes, I think.
Okay, and oncolysis. You want to examine the
I
chest?
have also the chest. I think I have to check
For apical lung fibrosis?
Due to what?
For apical lung fibrosis. It is associated with psoriasis.
Yes.
For more with psoriatic arthropathy. Cardiovascular system.
Yeah, I forget.
The heart.
Yeah. aortitis, aortic regurg. I think it is commonly associated with psoriasis also. Yeah.
Yeah, what's your differential diagnosis for this patient?
For the rash, it could be due to their treatment for hepatitis C or the antihypertensive medication. It could be de novo psoriasis. The rash itself could be psoriasis, could be something like itchy rash. We have to differentiate from lichen planus or eczema.
Yeah.
I think it is this is for the right. I mean, the right.
Yeah,
term,
what
I
you are going to
remember
do
is-
for this patient?
We're going to do the basic investigation and blood in the form of blood tests, urea, electrolytes, and the basic investigation. Then I have to send a snap from the rash. I will do a test for the rash to confirm the diagnosis, and also we have. To check their autoimmune profile.
Okay, serum uric acid, you are going to see serum uric acid.
I'm not sure.
Psoriasis is associated with hyperuricemia.
Yeah.
Hyperuricemia because of the degeneration of the rash.
Yeah.
Okay.
For the treatment, I think
And of
we
course
have
to
to
refer
start
the
with
patient.
topical. Yeah. Refer the patient to what?
Referral for multidisciplinary team, of course, for to solve the problem of interferon alpha. Interferon alpha is the one who can precipitate psoriasis rash, so this patient has to be referred to from gastroenterologist and the dermatologist to decide the plan of management according to outweighing the risk versus the benefit.
I told the patient that I have to refer her to the multidisciplinary team to
Yeah.
to do what
What's
he
this in
said.
the plan of management also?
You are right, Dr. Sir.
Okay. The treatment, Dr. Ashraf?
Treatment, we start with topical treatment. I think in the form of vitamin D, Lanestrol, I think, and then topical steroids.
Yeah.
If no response, we have to do ultraviolet exposure. I don't remember exactly the name. UVA, I think. We can give it the methotrexate. Yes. If no response, we can give methotrexate to control her rash. If the rash is by more than 20% of the body, I think we have to give her a biological treatment.
Okay. Thank you, Dr. Ashraf. Well done, Dr. Ashraf. So again, from the history, any skin rash of onset, course with duration, progression, site, size, color, a worsening factor and improving factor. Is it painful? Is it oozing? Is it lynchable? Is it itchy? And for psoriasis, we have to ask about other systemic involvement with psoriasis, like any nail changes, any joint pain or back pain, because maybe they are associated with psoriatic arthropathy, any eye pain or redness for anterior uveitis, any cough or shortness of breath for apical lung fibrosis, any chest pain or racing of heart beats, or leg swelling for aortic regurg and aortitis. Then social history, medical history, family history, and the drug list of the patient. And the drug list is very important in this patient because there are some drugs which can precipitate psoriatic rash, like ACE inhibitors, beta blockers, cyclosporin, antimalarials, indomethacin, and lithium. And on examination, we have to examine the rash. What? On examination, we have to examine the rash carefully and examine the hair, the eyes for anterior uveitis or any redness of the eyes, and the hairline and the post-auricular area for scalp psoriasis. We have to examine the hand for any signs of arthropathy. For psoriatic, you have to check for psoriatic arthropathy, and for nail changes in the form of nail biting, transverse ridges, and ankylosis and the subangular hyperkeratosis. You have to put your stethoscope on the apex of the lungs for apical fibrosis. Cardiovascular system in the aortic area, you have to put your stethoscope in the aortic area only for aortic regurg and aortitis. That's all in examination. Okay, in the reply of the concern, like Dr. Ashraf said, most probably you have disturbance of your immune system, or your defensive system. This is better, your defensive system, which supposed to attack the bugs, but in your condition it's attacking the skin, causing proliferation and development of your skin layers. So what we are going to do is to do for you first a blood test. First a blood test and take a snip from your skin to confirm our diagnosis, and we refer you to a specialized doctor to give you the plan of management. It is very important to mention the precipitating factor and triggering factors to avoid for the patient. This patient is taking alcohol, smoke, and she's a smoker, and she's taking also lisinopril. All of these can trigger her skin rash. So you have to advise here, we are going to exchange for you the treatment for your hypertension, which with a safe treatment, because the treatment you are receiving can worsen your skin rash. You have to stop also smoking, and we can help you in this by referring you to a stopping smoking cessation, because smoking can trigger your skin rash as well. You have to stop also alcohol, because alcohol can trigger your skin rash. Regarding psoriasis with interferon alpha, yes, interferon alpha is one of the triggers of your skin eruption, but it is important treatment for your hepatitis C. So what we are going to do is to do for you multidisciplinary routine from a gut physician and skin physician to outweigh the risk versus the benefit of the treatment. And according to that, the decision will be taken to continue interferon alpha or not. بالنسبة لي what the investigation, as Dr. Ashraf said, any case basic investigation is specific. Basic investigation, CBC, lice, kidney function, liver function, and we can add in this case serum uric acid for hyperuricemia, and we can take a biopsy from the skin to confirm our diagnosis if we are doubtful. Okay, دكتورة رفعت تقدري تقول لنا what the histopathology of psoriasis?
Histopathology, hyperkeratosis, absence of the granular cell layer, elongation of the leafy ridges, infiltration of lymphocyte in the epidermis with the formation of mycore abscess.
And dilated capillary, subepidermal capillaries, I think. Hyperkeratosis, acanthosis, and loss of granular layer, and multiple abscess of Monroe, and dilated capillary subdermal capillaries, and lymphocytic infiltration. They can ask about that in the exam, about the histopathology. It is rarely to be asked, but it can be asked, the histopathology of psoriasis. It is present already in OCT book. Okay. So the treatment would be the form of non-pharmacological and pharmacological, non-pharmacological patient education and counseling, occupational therapy, and psychosocial support. And pharmacological local treatment, local steroid, local keratolytic, tar, diethylenol, and systemic treatment in the form of buva and steroid-sparing drugs, methotrexate, cyclosporin, cyclophosphamide. And if the patient not responding, we can proceed into a biological treatment, tacrolimus, for example. No, a biological treatment in the form of etanercept and adalimumab. Okay, you want to add anything in this station? Okay, we'll proceed to the third case, Dr. Rasha.